AVN. So this condition poses a serious threat to the bone health. And in this video, we will explore what avascular necrosis is, its causes, symptoms, and potential treatment options. And at last, we'll talk about the homeopathic medicines for the treatment of avascular necrosis. So join me as we shed light on this silent but significant threat to our skeletal well-being, or simply you can say bone health. So watch this video till end for more knowledge and stay connected with us for more informative videos like this. So let's discuss about avascular necrosis. So avascular necrosis, it is a condition where a lack of blood supply leads to death of the bone tissues. Bones are living structures, and like any living tissues, they require a blood supply to stay healthy. So, when this blood supply is disrupted, as is the case with avascular necrosis, the affected bone begins to break down and may eventually collapse. I hope the meaning of avascular necrosis is clear to you guys. Now, next, we'll talk about the bones which are prone to avascular necrosis. So, avascular necrosis can involve almost any bone of your body, but it mostly affects hip joints, knees, and shoulder joints. Among these, hip joint is the most commonly involved joint. The bone mainly involved is the head of the femur, which is a bone in the thigh extending between the hip and the knee. Next is humerus, which is a bone in the upper arm extending between the shoulder and elbow, and its next commonly affected bone. Scaphoid bone, that is bone in the wrist, jaw, ankles, hand, and foot may also be affected as well as as well. So these are the bones which are prone to avascular necrosis. Now next we'll talk about the etiology, that is what are the causes, potential causes which are responsible for avascular necrosis. So first and the foremost cause is trauma. So trauma to joint injuries, fractures or dislocations can damage blood vessel supply to the bone. Second cause is steroid use. So, prolonged high dose steroids use can interfere with the blood supply to the bones. Next cause is excessive alcohol consumption. So, heavy drinking is a known risk factor for avascular necrosis and particularly in the hip. Next condition is medical conditions. Next cause is medical conditions. So, conditions like sickle cell anemia, lupus erythematosus, and other autoimmune diseases can contribute to avascular necrosis. And last cause is joint disorders. So, some joint disorders such as arthritis can indirectly lead to insufficient blood flow to the bones. So, these are the potential causes which are responsible for avascular necrosis in the bones. Now, next, we'll talk about the clinical features. That is, what are the symptoms of avascular necrosis? So, in the beginning, there will be no symptom noticed by the patient, but gradually, when depth of the blood cells start increasing, pain in the affected joint can be felt. For example, in case of avascular necrosis of hip joint, pain may be felt in the groin, thigh, or in the buttocks region. Initially, pain is felt when the joint is put under pressure. And in case of hip or knee avascular necrosis, walking, standing, stair climbing becomes very difficult for the patient. Limping occurs while walking, and as the condition reaches the most advanced stages, pain in the affected joint increases in intensity due to small breakage in the bone of the joint. The symptoms of avascular necrosis may occur on both sides of the body. In jaw avascular necrosis, pus may be present. So these are the symptoms of avascular necrosis. Now next we'll talk about the stages of avascular necrosis. So we have two types of classification of the stages of avascular necrosis. First, we'll talk about the four stages classification as per the progression of the avascular necrosis. And next, we'll talk about the four stages classification system of avascular necrosis based on a standard radiographs. So first of all, we'll talk about the four stages as per the progression of the avascular necrosis. So in the stage 1, what happened in this stage, X-ray is normal, but in MRI, dead bone can be detected. At the second stage, X-ray can reveal bone damage changes related to avascular necrosis. And at this stage, the collapse of the bone of femoral head has not taken yet place. At stage 3, X-ray shows sign of bone collapse, which is a crescent sign. And thus at stage 4, it is a serious stage. At this stage, X-ray shows bone collapse and significant cartilage damage, which is called as osteoarthritis. Now, next classification of stages of avascular necrosis based on the standard radiograph, that is FCAT. So at the stage 1, radiograph will be normal, but at stage 2, in this stage, femoral head contour is normal, but in radiographs, sign of bone remodeling are seen. Means cystic and sclerotic portions can be seen. And at the stage 3, what happens? Flattening of the femoral head occurs in this stage. And at the stage 4, it is characterized by narrowed joint space and degenerative signs in the acetabulum. Okay, so this was all about the broad classification of stages of avascular necrosis. The next sentence is totally wrong. So, in order to diagnose avascular necrosis, we have imaging tests like X ray, MRI, and CT scans. They are the only tests which are used to diagnose avascular necrosis and assess the extent of bone damage. And apart from this, we also have physical therapy, exercises which are used to maintain joint mobility and reduce the stress on the affected bone. And in advanced cases, procedures such as core. Now, next, we'll talk about the treatment. So, what is the ultimate treatment for avascular necrosis? So, here we are talking about the homeopathic treatment. Now, we will talk about the homeopathic medicines which has been used for the treatment of avascular necrosis. So, let's talk about the homeopathic treatment. So, homeopathic treatment for avascular necrosis uses the body's own restorative processes to heal. It basically aims at halting the destruction of the bones in patient of avascular necrosis because of the interrupted blood supply. The second aim of homeopathic medicines is to reduce the pain in the bone because of the bone damage, and both these aims are accomplished by the use of natural homeopathic medicines, which has zero side effects and are completely safe. The homeopathic medicines are selected after taking into account the proper case history of the patient, and the medicines are prescribed based on the bone involved, the kind of bone pain and other peculiar symptoms in each individuals. Okay, we have to look for the totality of the symptoms, and after making the totality we will find out the simillimum, and then we will prescribe the simillimum, that is optimum medicine. Now, let's talk about the first and the foremost homeopathic medicine for the avascular necrosis. So, on the screen, you can see first medicine process is present. And apart from its universal healing action to stop the destruction of the body tissues, syphilinum is of great help in treating bone necrosis. The most dominant feature for selecting syphilinum is any case of avascular necrosis is the worsening of the bone pain at night. The person experiences pain throughout the night and is unable to sleep on account of the severe pain. The pain may compel the patient to walk, which seems to bring relief. Such persons remain comparatively well the whole day. And another marked symptom that can help in selecting syphilinum for avascular necrosis cases is a specific pattern regarding the appearance and the disappearance of the pains. The pattern followed is a gradual increase in the bone pain and the same way a gradual disappearance of the pains. The third symptom that may be present in a few avascular necrosis patients needing syphilinum is worsening of the pain because of the heat and some relief by applying cold water. And history of excessive alcoholism may be present in persons requiring syphilinum. Now, second medicine for avascular necrosis we have is strontium carb. So, strontium carb is a very excellent homeopathic medicine which is recommended for the cases of avascular necrosis of femoral bone, which is a bone in the thigh. So, those needing it have worsening of pain in cold air. And beside avascular necrosis, it is a prominent medicine to deal with the cases of weak and brittle bones which are prone to break easily. Now, third medicine for AVN, that is avascular necrosis, is natrum sulph. So, natrum sulph is extensively used for the hip joint necrosis. It is one of the most beneficial medicine when dealing with the hip joint avascular necrosis. The patient may complain of pain during movements or when stooping. Next medicine for avascular necrosis is fluoric acid. So, fluoric acid is the most effective for the necrosis of the long bones. The bones include humerus, femur, and tibia. Fluoric acid is mainly used to halt necrosis appearing in long bones. The person needing fluoric acid usually have excess body heat and external heat worsen the condition. And apart from the long bones, necrosis of the bones of the ear, which are rarely involved, are also covered under fluoric acid, which help in improving the blood circulation and preventing further necrosis of the bones. Next medicine for avascular necrosis is asafoetida. So this is a very wonderful homeopathic medicine for the avascular necrosis of tibia, which is a bone in the leg. There is a worsening of the pain at night along with oversensitivity in wounds. The bone pain can be darting, sharp, and stitching in nature. Next medicine we have is silesia. So this is considered as a wonderful homeopathic medicine for necrosis of the bones. For necrosis of variety of bones ranging from long to small bones. The necrosis of the jaw, wrist bone, hand bones, feet bones, ankle, knees, and long bones, including humerus, femur, and tibia, are the sites of action of using silesia. The general symptom for using silesia is sensitivity to cold air when bone pain worsens even from the slightest exposure to cold air. Warmth brings relief. Now, our next homeopathic medicine is orometallicum. So, orometallicum is a natural homeopathic medicine which is very beneficial in the treatment of necrosis in the nasal and the palatine bones. The mastoid bone is also the site that benefits with the use of orometallicum. The patient complains of pain at night and may suffers from extremely offensive odor from the mouth and nose along with the pain. The patient may also feel depressed with a high degree of sadness, so aurum metallicum is a excellent choice of medicine for such patients. Now our last homeopathic medicine, last but not the least, that is symphytum, very common bone medicine in homeopathy. This is extensively used and very commonly used for bone problems, especially fractures. So, for the bone damage in fractures, symphytum is used as a very common medicine. Symphytum can be considered in all cases where the bone has suffered damage following fractures. It helps in proper knitting of the bone. This is helped by providing the necessary callose material which is needed for the bone reformation. So, in every case of fracture where symphytum is used, it acts as a preventive agent against necrosis as the bone is very neatly and efficiently woven by this medicine. So, this was all about the homeopathic medicines which has been used for the treatment of avascular necrosis of various types of bone in the human body. So, that's all. In conclusion, I want to say that avascular necrosis is a serious condition that damages and it demands our attention. So, by understanding its causes, recognizing symptoms, and adopting preventive measures, we can take proactive steps to safeguard our bone health. So, if you find this video informative and helpful, please give it a thumbs up and subscribe to our YouTube channel and hit the notification bell so that you won't miss the future content. And thank you so much for joining us today as we explored the world of avascular necrosis in bones. So, see you guys in the next video. Till then, stay safe and stay healthy. And if you are suffering from any of the health illnesses or bone health, bone diseases, okay, so you can contact us for online appointments. On the screen, you can see how you can contact us for online consultations. So, that's it for now. And thank you so much for watching this video.